Hi all! In this video, we will understand the cardiac cycle, covering all the phases, valves, pressures, heart sounds, and quick exam tips. What is cardiac cycle? It is a sequence of events that occur in the heart during one heartbeat. That is from the beginning of one heartbeat to the start of the next. Duration is zero point 0.8 seconds. The mechanical events follows the electrical events. Phases of cardiac cycle. First is atrial systole, that is around zero point 0.1 seconds. Here, the atria will contract and pushes the blood into the ventricles. So, the ventricular filling becomes complete. Next is atrial diastole. Here, the atria relaxes and fills with blood. And it continues through ventricular systole, ventricular diastole, and ends just before the atrial systole. It is about 0.7 seconds. Ventricular systole. It is about 0.3 seconds. In that, the first thing is isovolumetric contraction. It starts with the closure of mitral valve and ends with the opening of semilunar valves. Here, the ventricles begins to contract, all the valves will be closed, so the pressure rises rapidly. We can hear the first heart sound S1 lump due to the closure of mitral and tricuspid valves. Ventricular wall motion is maximum in this phase and it is the phase of highest oxygen consumption. Next comes rapid ventricular ejection. As the ventricular pressure becomes more than the aortic or pulmonary pressure, semilunar valves opens up. Blood is suddenly ejected with high velocity. Then comes slow ventricular ejection. Here, the ejection velocity decreases as the ventricular pressure reduces. Next is ventricular diastole. It is around 0.5 seconds. In that, the first thing is protodiastole. Period just before the closure of semilunar valves, where the blood is moving out of the ventricles due to the momentum of blood, even though the ventricle has started relaxing. Next comes isovolumetric relaxation. It starts with the closure of semilunar valves and ends with the opening of mitral valve. All the valves are closed again, hence the ventricles are relaxed as a closed cavity. So it is called as isovolumetric relaxation. We can hear the second heart sound S2 dump due to the closure of aortic and pulmonary valves. Next is first rapid filling phase. Here the atrioventricular valves opens and blood quickly flows into the ventricles, so the ventricular volume increases. Next is slow filling phase. Due to reduced pressure gradient between atria and ventricles, filling occurs slowly in this phase. And also ventricular wall motion is least in this phase. This phase ends with the next atrial systole. That's all about cardiac cycle. Now we can discuss quick exam tips. Semilunar valves open during ventricular ejection period. S1 is heard when atrioventricular valves close and S2 is heard when semilunar valves are closed. S3 is heard in rapid filling phase and it is normal in kids and abnormal in adults. S4 is heard when atrial contraction against a stiff ventricle. The cardiac cycle duration decreases in tachycardia. S1 marks the beginning of systole and S2 marks the beginning of diastole. So that's all. So if this video made the cardiac cycle easy for you, don't forget to like, share and subscribe. Thank you.